Benjamin George from Helping Hands for Hospitals, based in New Jersey, United States of America. I'm so thankful to Seni Uman from Houston Voice, recording in Atlanta. When I met Seni Uman in a conference, CSI conference in Atlanta. I'm so thankful for Seni, who is recording my story, and it is such a joy to be with Seni Uman and the Houston Boys to give an account of what we are doing in India, in Nepal, and Bangladesh. Helping Hands for Hospitals International Incorporated is a 501c3 charity organization founded in 2016 as a charity organization for the benefit of the mission and related hospitals in different parts of India. As you all know, the health delivery system in India was well managed by many of the hospitals in different parts of the country, run by churches, many missions. It is such a pathetic situation to see that many of the hospitals are going through such difficult times in many parts of India. And as you know, so many mission hospitals are unable to function because of various reasons, including lack of funds, lack of people. And it is our desire and hope to resurrect some of these hospitals which are not doing very well, which are suffering monetarily, and lack of proper personnel to run the institution. 2016, a group of doctors met in a place called Coimbatore in Tamil Nadu, South India, to discuss about the problems facing the many mission hospitals. And it was in that meeting it was decided to start an organization named Helping Hands for Hospitals, and under the leadership of Dr. Jason Mathai, a cardiologist from Dubai, who was a professor of cardiology in CMC, Christian Medical College, Ludhiana, Dr. Abraham Thomas, a pediatrician from New Jersey, and Benjamin George, an ENT surgeon turned anesthesiologist working in State University of New York Medical School in Brooklyn, New York. So we decided to first start the organization to connect the hospitals and the providers who could go and give their time and their energy and their finances and their advice to those hospitals which are suffering. And so we started by connecting the hospitals to these providers. And as time went on, we started visiting hospitals and conducting medical camps and conducting surgical camps, and try to improve the functioning of the hospitals by providing infrastructure for the hospitals. In the course of the formation of this organization, as we are continuing to help many hospitals, especially in North India and some hospitals in South India, in Coimbatore, in Hyderabad, and many other areas, we found that COVID affected many hospitals and they needed medical supplies, They needed supplies for their and they found it difficult to function, and hence we were able to send adequate help for respiratory equipment, as in terms of respiratory equipments, and also we were able to supply funds and also support them in various ways in the different parts of India. Every year, Helping Hands for Hospital as a team would go to different hospitals and conduct medical camps, support their team by doing surgeries, by giving them proper advice, and this work is continuing. Helping Hands for Hospitals is the organization which has grown to support many hospitals in India at the moment. It is such a joy to see that we have grown from the original situation, original plan to connect the hospitals with the providers. We started supporting the hospitals in their ministry, in their work. Every year we go to hospitals and villages conducting medical camps, surgical camps. We primarily selected a hospital in North India, in Bihar, one of the worst affected state in Bihar. One of the worst affected state in India is Bihar, and the worst district in Bihar is Madhepura. And Madhepura, there is a hospital which was not doing well, but with the work of Dr. Arpit Matthew and his team, the work is improving, and we were able to give a hand to their development. We were able to go and do surgical camps. We were able to help them with equipments like microscope and other ENT surgical equipments, so that they could function better. And also we were involved in the village ministry by helping to develop the school in Madhepura. Also we intimately involved in a work in a place called Sundarbans in Calcutta. Calcutta Sundarbans area is mainly a fisherman area, and the community is a very extremely poor community, and they needed a lot of help. Pastor Akhtar Mullah, a wonderful man who has been working in Calcutta area, had been asking for help to help the villagers. The medical help was so poor because of the poor access, as they are all villages spread across the islands. There are about 50 islands in the Sundarbans area, and most of the people are fishermen community, and they are extremely poor. We were able to go and do medical camps every year, and that is still continuing. When we went to find the medical camps, we found that people are all below poverty line, and they didn't have good drinking water, and they had dirty water around their houses, and they didn't have any adequate housing. They didn't have adequate sanitary facility. So we decided to support them by giving houses where they could stay without getting rain and heat. We decided to supply deep borewells in several villages, and the work is going on. By divine intervention, we were able to supply 7 wells already, and we are planning more wells. We were able to give 20 houses in Sundarbans area, and then our target is to give 100 houses. We are continuing the work in Sundarbans by giving bathroom facilities. We were able to give already 10 bathroom facilities. Our goal is to give 100 bathrooms. As I said, the ministry is growing, and we would like to appeal everyone who has heard this message to be part of the Helping Hands for Hospitals. Helping Hands for Hospitals is, as I said, is based in 299 Green Street, Old Bridge, New Jersey 08857 in USA. And the vision of the Helping Hands for Hospital is to address to the lack of the infrastructure, medical and human capital needs of the financially ailing, reputable and committed healthcare facilities in India, Bangladesh and Nepal. The decline of the efficient medical institutions and the lack of the committed healthcare providers actually poses a great significant crisis in the healthcare delivery in India. And this can be corrected only by providing and improving the infrastructure of the hospitals and taking the health needs to the community and to serve the community in their homes. We are partnering with many agencies like CMAI, Christian Medical Association of India, EMFI, Evangelical Medical Fellowship of India, and other organizations. And anyone who is interested to be to partner with us, please join us on the website helpinghospitals.org. helpinghospitals.org. You could contact us by sending an email to hhsecretary1@gmail.com and access our website through helpinghospitals.org. We are available to answer any questions. Ms. Phoeba Phillip is stationed as the administrator in India, and she supervises the work in India. And once again I would request your help and your support for the Helping Hands for Hospitals International Incorporated. Together we can make a difference. We can make a change in our country and the neighboring countries like Bangladesh and Nepal.